So today I'll be talking about closed head injury, classification, and brain contusions. Closed wound, it is a wound in which the skin is intact and the underlying tissues are not directly exposed to the outside environment. So the tissues have been harmed from the inside. So some of the closed wound in the brain region includes like contusions, hematomas, crush injuries, blunt trauma, not just in the brain region but everywhere. But I'll be talking about brain contusions over here. So cerebral contusions, these are bruises of the brain usually caused by direct or strong blow to the head. You can see in the picture. The word contusion is basically another word for bruises, a collection of blood not in the blood vessel. Contusion can also be referred as hematomas. Contusion can also occur in any part of the body subjected to trauma that rupture blood vessel. For example, say you get hit in the arm with baseball and it bruises. Symptoms. The common symptoms include minor pain and swelling on the area where you hit your head. When symptoms are present, they range from minor to life-threatening and can include changes in cognition, such as alteration in personality and reduction in intelligence, difficulty understanding speech, memory challenges, localized numbness or tingling, difficulty coordinating, difficulty speaking, problem with attention. There are several types of contusions. Main three are mild, moderate, and severe contusions. And this classification is based on the type, depending on the location and the amount of internal bleeding that occurs. Mild contusions, common head injuries resulting from blow to the head, can result in mild contusions, and they have only surface bruises at the site of impact, may associated with some pain at the injury site, but with no noticeable long-term effect. Moderate contusions include internal bleeding near or around the brain and are often caused by more severe head traumas. These contusions may be accompanied by concussions and can cause more severe symptoms such as short-term memory loss, difficulty floating, loss of consciousness, etc. Some moderate contusion symptoms may persist even after this treatment or recovery. Severe contusions can be life-threatening conditions that require medical attention. When these contusions occur in the brain, they can result in concussions-like symptoms. Severe contusions should also be treated as soon as possible to prevent or limit permanent harm. Even with treatment, there can be permanent damage, although prompt care can limit the severity of this effect. Treatment. Contusion treatment options will vary depending on the severity and its location in the head. Mild contusions may go away with simple passage of time, but moderate and severe contusions may require invasive surgery or the use of the prescription medication. But before giving actually the treatment, the doctors need to diagnose or like examine the patient to determine the location. So they used various options for that, like visually inspect the injury site, palpate or touch the injury area for test for pain, take X-ray of the injury, or conduct a magnetic resonance imaging like MRI. Thank you.